Hello, everyone. I'm Jim Garrison. I want to welcome you to day 102 of Humanity Rising. Just about every day since the 22nd of May, Ubiquity University and over 300 partnering organizations from all over the world have come together to convene a daily open space starting at 5 p.m. Central European Time that has enabled people from all over the world to come together to share their experiences of how we're all navigating through this quite extraordinary pandemic that's put most of the world in lockdown, stalled our economies, created a new social norm of social distancing, and made us all acutely aware not only of public health and personal health, but the human future. One of the challenges of us all, particularly those of us who work tirelessly day in and day out for a better world, is how can we somehow, in the midst of this crisis, come together with enhanced strategic effectiveness? How can we ensure that the solutions that we know exist can be implemented and scale globally? Now, that's the challenge of the hour. And scientists are telling us the hour is late. We're running out of time because climate change in all its dimensions, from extreme weather events to the catalyzing of pandemics, is spinning out of control. So today, we're very fortunate to be delving into the very important subject of climate change, public health, and litigation. But before we dive into that very weighty matter, I have a very exciting announcement from Humanity Rising Netherlands. As you may know, we launched this past Monday, Humanity Rising Netherlands. There's been a very active, very enthusiastic Dutch group that wanted to just create a local Humanity Rising chapter in Dutch. And they've been working very, very energetically over the last several months under the leadership of Jolanda Eigenstein, who is a very dynamic corporate CEO and force of nature. And they launched on Monday at 7 p.m. Central European Time. And it turned out that on Wednesday, the head of the Dutch national COVID response listened to Humanity Rising Netherlands and found it so informative. Turned out he went on national television later in the evening, and he spoke about Humanity Rising Netherlands and everything that he had learned. And that went out to, I think, 5 or 6 million people, as I understand it. Then yesterday, he and Jolanda talked, and he'll be on Humanity Rising this evening in the Dutch edition. And what's now emerging is a national campaign around face masks that Humanity Rising Netherlands is catalyzing in partnership with public health officials and interested parties, corporations, all across the Netherlands. So it's a wonderful, wonderful thing, everyone, to just see how, an idea to have an open space on the part of Ubiquity University and some of the senior staff all of a sudden just spawned a coalition of over 300 partnering organizations. It's only 2 or 3 months. And we have another half a dozen, 7, 8 Humanity Rising chapters just burgeoning out there, in Colombia and Chile and the United States and the UK and Australia. It's so affirming to witness the upsurge of human goodness in the world. the headlines would suggest all is lost. And at times it feels like it is. But with day in and day out manifestations, as we're going to witness today, of people that are working tirelessly 24/7, 365 to make the world a better place, I'm actually getting more and more optimistic. And my heart is full of joy and gratitude at just the goodness that infuses our world. One of the things we like to do every day on Humanity Rising is to take just a minute and engage in heart coherence. As Prigogine said, the exercise, the challenge is to create islands of coherence in the rising sea of chaos. And the simplest way to do that is to take a couple minutes, sometimes put your hand over your heart, and just for a minute, attune yourself in a spirit of gratitude and listen to your heartbeat, giving thanks that you're alive at this time for the purpose of saving life. Thank you, everyone. It's always good to just attune to the heart. Reminds me of a famous philosopher of the 18th century, Friedrich Schilling, German philosopher, who said, "Humanity will only change when our intelligence comes from our heart." We're shifting our focus now to the weighty matter of climate change and public health and litigation. But before we do, I just wanted to offer a little anecdote that came out of the news from San Francisco today that has to do with nature and climate change and the pandemic. Scientists have been monitoring the bird calls. And they said that in the aftermath of the pandemic, when traffic slowed, the city became quieter, people were largely in their homes, not only did the animals start to come out and play, but the scientists had been recording the male mating calls. And they noticed that after the pandemic began, that the mating calls of the birds in San Francisco became softer and softer, but could be heard twice as far. And I thought, what a beautiful, beautiful little image of the finely tuned natural ecosystem of which humanity is a part. You know, when you're at a party or you're at a very busy bar with a lot of loud rock and roll music, you have to shout. Well, the birds, with all the tumult of traffic and the hustle and bustle of a big urban center in the United States, were having to shout all the time. And after the pandemic started, they could relax again, but could be heard twice as far. That's a beautiful thing. Now I'd like to turn the program over to our panel today, and starting with Jenny Z, who will introduce herself and this very important topic of climate change, public health, and litigation. Jenny, welcome.
Thank you very much, Jim. Such a touching opening that you have shared with us. And today, actually, on the panel, we have two people who are presenting, and I think all of us are pretty soft-spoken people. And so hopefully even our soft voice can be heard through long distances. I'm just going to set the context for our panel today with a first definition of what public health is. Public health is defined as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. And this definition came from the WHO. Public health, climate, and environment are very closely linked. As Jim just mentioned, there's climate crisis happening like wildfires, hurricanes. These recent events have really impacted human health. At the same time, we also have health crises like COVID, which some argue that it is also linked to the environmental changes. All these crises have tremendous impacts on our lives in terms of job losses, economic downturn, and then impacting us in our physical and mental well-being. So today we are going to have our two panelists talk about what systems are currently set up in the public health as well as the legal sector. How are people in these sectors addressing these issues, and how can the public engage? So first, we will hear from Dr. Chadia Wannous. We're really honored to have her join us today. Dr. Wannous is a health, emergency, and risk reduction expert. She's currently the coordinator of Toward a Safer World Network, a network dedicated to advancing pandemic preparedness and risk reduction of health emergencies. Prior to this, she was a senior advisor at the UN Office for Disaster Risk Reduction and had served as a senior policy advisor to the UN Secretary General Special Envoy on Ebola and the UN System Influenza Coordination. She also worked for the WHO and is currently the chair of the World Federation of Public Health Association Working Group on Health in Emergencies and Disasters. As you can hear from her long list of qualifications, Chadia brings a wealth of knowledge, and she has worked across a large number of countries in the Middle East, Southeast Asia, the Caribbean, and North America. With that introduction, Chadia, please turn on your camera and unmute yourself.
Thank you, Jenny. Thank you very much. Can you hear me?
Yes, we can.
Great. Thank you. It's a great honor to be with you today. This is my first time with the Humanity Rising, and I'm very touched with the opening by Jim from the heart. It's really wonderful, and it talks to the core of my presentation on how we deal with our nature and how this affects climate change and ultimately our public health. So I will start my presentation and share my screen. Give me just 1 minute. I think it's the one. Can you see it?
Yes,
Jenny,
we can see it, Chadia. Thank you.
Great. Thank you so much. Okay, so my talk today is about climate change and public health, and I will touch a little bit on litigations, but I will leave it to my colleague Nolan to take it further in his presentation that follow. Now,
Chadia, excuse me, could you make it full screen? It's not showing up.
Oh.
Because of your projection, it is showing in a projection mode instead of the normal full screen mode.
Okay. How about now?
Yes, that's good.
Okay, great. Okay, so just to start by saying that we are witnessing through the last few years many outbreaks, epidemics, and pandemics around the world. And as you can see from this slide, the number and the severity of these outbreaks are increasing with time. I try to see how to advance the slides.
There may be a button on the left-hand corner.
Yeah, I can see it. Just a minute. Sorry. Okay.
What are you seeing, Shonda?
Just the screen, but nothing is moving. So I will stop sharing now, just a minute to see what's going on here.
Right. As Jeannie said, it should be down in the left corner of your screen.
Yes. Okay, 1 minute, please.
Also, another option is I can share the presentation if you like.
Yeah, okay. Yeah, this will be good. Sorry about that. It's a little bit challenging.
Not a problem. Don't worry about it. Looks good from here. Go ahead.
Yeah?
Shonda? Yeah.
Okay, good. I think because I'm using two screens, it's not helping.
Chadia, I am already sharing the presentation on the webinar, if you could. So you can go ahead when you're ready.
Yeah, just explain when you want the slide to advance, Chadia, and we can keep up with you.
Okay, great. Thank you. So yeah, just as I said, we are witnessing more and more pandemics bombing out around the world, and I will explain why this is happening. Now, next slide, please. So Actually, we have 60% of existing human infectious diseases are coming from animals, so we call it zoonotic. And also 75% of emerging infectious diseases are coming from the animal origins. Each year we have around 5 diseases new, 3 of them are of animal origins, and 80% of agents with potential bioterrorists are from zoonotic pathogens. And that's why this linkage between us as a human and the animal kingdom is very important to look at and to advance carefully. Now, second slide, please. So just to give you examples, because of this pandemics, it's not just the human cost of it in terms of illnesses or mortality, but also the economic and the social cost. Even when we have a small number of deaths or cases like we had in the SARS outbreak in 2003, we had a huge impact from the economic sector, and we lost billions of dollars because of this. Next. Now, if we talk about our COVID-19 pandemics, as you can see, within a few months, the cases increased exponentially, as well as the death. We have now, as of yesterday, we had 30 million cases and around 1 million deaths. If we look at the cost of the COVID-19 on our economy, it's over $11 trillion only in the response to, in the cost to fund the response. And we have an additional future loss of about 10 trillion because of lack of employment and economic activities. But if we talk about preparedness, if we invest in preparedness and in prevention of those outbreaks, all we need is additional $5 per person annually to do preparedness well and to avoid such catastrophes. But why countries don't do it? Why the donors and the investors, they don't invest in preparedness and they wait until the pandemic happened, and then we put a lot of toll on our health system, on our environment, on our social and economic sector instead. Next. Now, what drives disease emergence? It's all about human action and how we connect with our nature. It's about how we manage our forest, how we manage our productions, the intensive farming that we do, or the mining, or the infrastructure and the development project that we do. All of this put us in close contact with the wildlife and create the perfect storm where the pandemics can emerge. This also happened in areas where the communities are most vulnerable because of income or because of poverty related issues. In addition to this, the emergence, the spread of the disease are intensified because of the trade and the travel that is in explosive growth around the world. Next. Now, I want to talk about how we use our land and how this affects us. We know that our actions are significantly impacted more than 3/4 of the Earth's land surface so far. We have lost 85% of our wetlands, and we have dedicated more than 1/3 of our all land and 75% of our fresh water just for agriculture, for crop and livestock productions. Next. Now, we did also more than this, the deforestation that we have done to our mother nature. as you know, the forest covers 31% of our land, but we are losing this at the rate of 2 to 3% of the global forest each year. And we are doing this by the deforestations, cutting the trees for agriculture, for ranching, for farming, for development, but also for unsustainable logging for timber, for example. And also because of climate change, the forests are degraded. Now, the forests have an important function for our life on Earth. It provides us with the food, the shelter, the water that we need, the air that we breathe, but also it mitigates climate change because it acts as the carbon sink by soaking up the carbon dioxide that would otherwise be free in the atmosphere and contributing to the climate change that we are witnessing now. It is estimated that 15% of the greenhouse gas emissions are coming from deforestation that humans are causing. Next. Another risk driver is our urbanization. Currently, we have 50% of our population living in urban cities. And it's expected that this will be 70% by 2050. But this huge urbanization and very rapid, it's causing us to witness a lot of inequalities and to contribute to climate change through pollutions or through the aging of building and infrastructure. This is happening mostly in Africa, followed by cities in Asia and the Americas, and this will put them at vulnerable situations to be exposed to climate change. And what we know that only 15% of cities in low-income countries, they actually use this information. They use land use planning to inform their decision for cities or human settlements. Next. Now, our aim is to enhance our urban resilience. We know that 90% of the urban areas, they are located at the coast, and this will put them at risk of disasters like hurricane, floods, and other natural hazards due to climate change. Luckily, we have an opportunity now to act on the new urban agenda that all member states adopted in 2016. And we have this window of opportunity to safeguard our urban habitat because we know that 60% of the urban places are yet to be built. So now we have the time until 2030 to act on it and do it safely. Next. Jenny, next. Yeah, so for climate change, it actually complicates the urbanization challenge that we already have. And it's estimated that by 2030, we will have millions of people pushed into poverty because of climate change from the urban residents. Climate change doesn't only affect people living in the coastal areas or the mega cities or the small island developing countries. It affects everybody everywhere. And especially those living in poverty or vulnerable group like women and children and the elderly. And even countries with weak infrastructure in terms of health system or environmental protection, they are more at risk of climate change. Next. So how this climate change will impact our health? It will have direct impact on us through the illnesses or the damage directly to the human populations. And we have an example from the extreme heat that happened in Europe that the death toll exceeded 70%, 70,000 population during the summer of 2003. We have also indirect impact in the way that climate change affect our environmental system, contributing to rising air pollution, but also to food, water, and vector-borne diseases that are sensitive to climate change, and they increase in areas not before seen, or increase in the frequency and the intensities in their endemic areas. Climate change also affected us through socially mediated effects by interaction with our social and human system, and resulting in undernutrition, mental illnesses, displacement of population, and also contributing sometimes to conflict and violent outbursts. Next. Now, this climate change is linked to disasters because we know that 90% of the disasters are weather related. And as you can see from this graph, the temperature is rising, our land use change is increasing, and that's why the frequency and the intensity of the extreme weather are also increasing. Next. Now, this disaster, they affect large segment of the population, and in 10 years, you can see from this graph that 2 billion population were affected, and the huge economic cost because of the disasters. Most of them, they were either flood or storms or water-related hazards. Next. Now to the important issue on how to deal with this pandemic. We know that animal-to-human diseases already caused an estimated 700 deaths each year. And we know that we have so many of unidentified viruses that have the potential to transmit or spill over from animals to the human and cause pandemics. Any one of those could be disease X, as we call it, with the potential to be disruptive as or more than COVID-19 that we are currently facing. So how to deal with the pandemic? We have to adopt a One Health approach that bring all the sectors together, most importantly, the health, the environment, and the animal health, and all the disciplines of science to provide the evidence for decision-making that take into account the long-term consequences and cost of development action for the people, but also for the nature. Next. What we have to do, these sectors, they are acting in silos. So we have to mainstream climate risk and biodiversity into our health system, and the opposite as well. We have to mainstream health consideration into the climate and the biodiversity sectors. And we have to educate both all the sectors on how to work in coherence and in synergy together. Next. Now we have so many regulatory framework that govern our climate change, our health, food safety, biodiversity, and disasters. But as I said, we need to understand better these regulatory frameworks, and we have to communicate the linkages between them and how we can work together to ensure that we have risk-informed sustainable development and build resilience communities and systems. Next. Now, I would like to focus on the regulatory framework for the public health in specific, which is the international health regulations. And this is a binding multilateral instrument that all countries signed on to it to work collectively with WHO to address the global spread of diseases. This framework obliges the states to notify WHO of any event that may constitute public health emergency of international concern, or FEC, as they call it, within 24 hours from the national authority doing the assessment of the risk. And why this international health regulation matters? Because this is the way to keep us safe. We know that the diseases, they don't know borders. We have to work together to ensure our health security. And by doing this, everybody will be secure and safe. Next. So this framework, it has a monitoring and evaluation framework accompanied to it. And it's a comprehensive process from doing simulation exercise to after action reviews to annual reporting done by the state voluntary to WHO. It also works to develop an action plan for health security and to implement it at the country level. And in 2016, a number of countries, they came together and they advocate for the inclusion of the joint external evaluation tool, which is done collectively with member states and experts from WHO and other partners and from other countries coming to the country to help them review their status of compliance with the core capacity of the international health regulations. And those core capacities, as you can see on the left of the slide, they center around 4 areas. It's about prevention, detection of infectious diseases or a threat to health, responding to those threats, and also looking at the issue of other hazards than infectious disease, such as chemical, nuclear, or radiological hazards, and looking specifically at the issue of point of entry, like airports or ground crossing, and what are the recommendations for travel and trade in case of pandemics. However, despite all this effort, and after almost 15 years following the adoption of this revised international health regulations, we still have only 1/3 of the countries that they meet the core capacity of public health system as required in this framework. And even countries that they done this assessment and they were said to be meeting those core capacities, when the pandemic hit the COVID-19, they faced a lot of challenges in responding to this, including countries in Europe or in North America, like Spain, France, Germany, and even the US. Next. So the experience with the COVID-19 and the decision by WHO to delay by several weeks the announcement of the pandemics or the declaration of the pandemic under this international health regulations prompted the call to revisit this framework and to revise it again to provide more legal authorities to do independent validation of the events, where we can send experts to the country to verify the events, and to ensure that we have information sharing from all sectors in the country, not just from the state, but also from non-state actors. And importantly, to change the way that we grade pandemics. It's not either or, but to have an incremental mechanisms where we have an intermediate stages that can prepare countries like an early warning system to prepare them for potential widespread pandemics. And importantly, also to have a financial mechanism that can be used to help countries, especially in low-income settings, to build their capacity to required under this framework. Next. So now we are talking about the stimulus packages following the COVID-19 pandemic and the talk about the green recovery from this threat. But these measures, they must be used to reduce the risk of future pandemic. We cannot go back to business as usual. We have to invest in preparedness. We have to build the resilience and to fund our health system, but also to look at the enforcement of the environmental regulations and to put incentive for countries and for companies and for communities to safeguard nature. And that's why we need a transformative change that promotes social and environmental responsibility of all the sectors. Next. Now we talked about the responsibility of governments, of private sector, but also there is a responsibility for the citizen, and the community engagement is vital in any like the defense strategy for all the health emergency, but also for climate change and other threats. And I just give an example from the intersection between climate and health litigation. The recent Australian case that were put forward by young Australians, bringing their case under the environmental law. It's the traditional way, but instead they challenged the government and they brought the case under the duty of care, that the government is responsible for providing and protecting the young population or the population in general from the impact of climate change. And this case is inspired by a landmark case that were in the Netherlands, where it was successfully argued in 2019, and the Dutch government that breached their duty of care to its citizens through the inadequate action on climate change. Next. Another example also, but this time not very successful, the California case, Juliana versus US, also brought forward by young activists on climate change at the age between 12 and 23. And they claim that the government actions and inaction also in the face of global warming, it violate their fundamental constitutional rights to freedom from deprivation of life, liberty, and property. Unfortunately, this case was not successful, and the court argued that this matter of climate change, it's not for them, it's not under the mandate of the court to look at, but it's for the political branches of the government to deal with it. Next. So I just provided you with an overall of the risk driver that drive our health emergency and what can be done about it. And I just would like to highlight more and emphasize the issue of interaction between the animal, the human, and the environmental sectors, and how it's important to work together to make our world more safe and more secure. Thank you.
Thank you, Chadia. Thank you. And we do have some questions that have come in for you already. I would like to ask anyone who have questions for Chadia to continue to put it in the chat, and I'll be monitoring that. Since you already talked about this transition to the legal side, I am going to introduce our next panelist, and then we can do all the questions at the end. Our next panelist is NarayanToolan. So Narayan is a legal futurist and earth advocate. He has experience in human rights, finance, intellectual property, and technology law. He had worked with the WFPHA, International Bridges to Justice, Royal Courts of Justice, and the Clifford Chance Legal Aid Center. He also co-founded a chapter of Legal Hackers in Geneva and is a graduate of the LSE and UCLA School of Law. So Narayan, please show your video and unmute yourself, and I'll get ready to share your presentation.
Hi there. Thank you, Chadia, for a very thorough presentation on environmental health. So now I'm going to introduce to you the wild and wonderful area of climate litigation. My objective in doing this is twofold. One is hopefully that you can understand what's going on in this area, and not only the details of the cases, but take away some of the trends and stories. And the second one is that you have the tools to engage in some way in this area. And the core message is really the link between climate litigation and human health. So if we look at the numbers of cases, there's more than 1,500 cases in total, more than 1,000 in the US. And since these cases began, after 2000, you can see the numbers are pretty quickly increasing. And this is also the areas of law in which cases are coming are also changing as well. So in terms of those areas of law, yes. So this is certainly not just environmental law. This involves, as Chadia mentioned, this Australian case where they're taking a different route. This is certainly a theme in climate litigation. There are many strategic cases, for example, brought through the UN Convention on the Rights of the Child, through OEC guidelines for multinationals, the International Covenant on Civil and Political Rights, and international human rights law. And in some ways, you could say this area is quite oriented towards the future, in the sense that company law, finance is definitely changing in this area. The question we need to ask is, who is responsible? Who are the cases against? Most of these cases are against governments. The reason for that is not surprising. If you look at the science, the IPCC reports in the last 40 years, it's really provided the evidence to be used in terms of linking carbonization with global warming. And if you just move to the next slide, please. There have been a number of successful cases. Chadia also mentioned this case in the Netherlands. This was the first, shall we say, case that really linked human rights with the reduction of emissions. So this case was only decided in December of 2019. And in this year, July 2020, we had a case in Ireland, which was also successful. That was based on Ireland's national mitigation plan. And there are ongoing proceedings in many countries, from Canada to the US to Belgium to France, Germany, Sweden, Switzerland, a whole range of countries. And I'm going to just step back a bit and just point to an interesting convergence that's taking place in terms of international environmental law and international human rights law. Classically, of course, human rights is about the aspiration of the common people, the Universal Declaration of Human Rights, whereas international environmental law was more about resources, very much anthropocentric, in the sense that it's focused on the use of the environment in terms of human uses, but these are converging in some way. And I want to link this in because everything's connected in some way with the model, the public health model, which Chadia touched upon. And this is that that climate change really impacts human health in not just one way, but three ways. I'm just going to reiterate this again, that the first way is directly, for example, droughts, fires, hurricanes. The second way is, let's say, the destruction of natural systems and a higher likelihood of a disease passing from animal to humans. And the third way is through the human systems, the laws, the business models, and all of that in some ways is slightly less visible, but it's very key, because climate justice is based on the principle that climate change will not impact human health proportionately. There will be some communities that will suffer more from this, and this is the more vulnerable communities. This is the poor communities. We've seen a case already, a refugee, a small island. This island is called Kiribati, and it's not far from New Zealand. And the water was rising. So this person tried to claim refugee status. In this particular case, because the water was rising slowly, they did not obtain it. And the UN Human Rights Council did not overturn it, but certainly with more refugees in the future, we could see a change in this area. So we really start to think about public health interventions at this point, and what might they be and how do they impact the law? As we've seen with COVID, when it comes to public health, sometimes there needs to be individual sacrifices. And certainly this is a principle of health law. In this particular case, somebody's property right had to be slightly set aside because of the interests of public health. And with climate change, this principle is only going to become more and more relevant. There was a case in Ecuador where some indigenous people had an oil company was drilling for oil underneath their land, and the oil company actually buried explosives there. So not surprisingly, that was considered a risk to public health. And in some ways, linking that again to climate, you could say that what's going on is kind of equivalent to actually burying explosives under the ground, and we just don't quite know when they're going to go off. So the people, I would say, again, as Chadia mentioned, there is a bit of a generation gap starting to emerge in this area, because young people are starting to realize that they're going to inherit this problem. In environmental law, there's always been this notion of future generations, whether the current generation can use the resources just as if they were there forever, or should they actually be thinking of the non-existent generations who cannot yet even bring their claim in law. But there are young people bringing claims in law. So there are a number of cases in this area, and they're only increasing by each year. For example, in this case of Sachi v. Argentina, 16, I would say, teenagers, children brought a petition through the UN Convention on the Rights of the Child. And some of these rights include health, prioritization of the child's best interests. We've seen a case, Future Generations versus Ministry of the Environment, which is on this actual point this of the last slide. And we've seen, Chadia already mentioned this Australian case, which is a very interesting way of, because in common law, this does not exist as a statutory duty. So if this could be established, it certainly would open up the door for litigation in more countries. And it's not only youths, because, for example, in this case of Maria Khan versus Federation of Pakistan, it really, the key point was around the rights of women. And we also see a case of Youth v. Climate Change versus Austria. And in this case, they've made the link between climate change and mental health. For example, if young people have to spend more time indoors, this is going to impact their mental health. So all of these cases, we're certainly moving away from seeing the environment as just a resource and putting human health right at the center. And next slide, please. So who else is responsible? We've seen that most of the cases are against governments, but with climate attribution science, the scientists are getting better and better at actually understanding, who is responsible. The idea of an environmental assessment is it's quite an old idea. Some of these things listed are actually renewable projects. So even if you have a renewable project, you would have to do an environmental assessment. But what's changing in this field is it's becoming, we're starting to have cases that look at this more of a broad policy rather than just limited to a specific project. So, for example, just this year, a very interesting case was started in Washington, D.C. versus the 4 major oil companies, ExxonMobil, BP, and Shell. So this is a sort of could be a watermark case because it's taking models from big tobacco cases about 20 years ago and making the claim that oil companies have systematically and intentionally deceived customers in the state about the role their products play in relation to human health. And there is a lot of evidence that their own scientists had very specific climate research that anticipated very specifically what has since come to be. There has also been a complaint against British Petroleum in violation of OECD guidelines. And in this particular case, it was claimed that British Petroleum were not fully representing their advertisements, not fully representing the real degree of their business model, which was based on renewable energy. And just, you know, just pointing out that in some ways, climate litigation is going mainstream in that it's moving away from being a question of environmental law and it's being about, say, financial law, company law. In this case, McVeigh v. Rest, this was a $50 billion pension fund in Australia, and the investor invested in this without having it disclosed to him that his investment was at risk due to climate change. So when it went to court, the court held that this must be disclosed in all cases. And so following up from that, we're seeing a lot of work in the insurance industry to really anticipate the risk of litigation. And we're seeing, you know, much more corporate governance and environmental and social governance standards. But you know, litigation and legislation doesn't always work. And it's when we look at all these cases, it's not always clear what is the actual relationship between a successful case and actually stopping climate change in some way. So because of this, I want to point to another project that's going on in the world of law, which is a group of lawyers are taking this more decentralized approach. So writing effectively green clauses for contracts, and with the aspiration that contract by contract, these can be inserted into the contract. And as you can see from the list, it's a pretty wide range, ranging from due diligence to supply chain contracts, you know, land transactions, many aspects of law. However, this is something which is really just begun. I would say as an alternative to litigation. So it's not clear what the actual effects of this would be. Next slide, please. So because for example, it's not so clear the impact of litigation, I want to introduce a very classic environmental idea. This was published in a Californian Law Review journal in the 1970s. And it says the world of the lawyers, people with inanimate right holders, trusts, corporations, joint ventures, municipalities, subchapter partnerships, and nation states. Streams and forests cannot speak, but nor can states, estates, infants, municipalities, or universities. So if we are going to in some way change the legal system, what I would hope that it's not just a surface change, that we sort of go deeper into the actual models and we change the models at a much deeper level. Because, for example, if you just look at this, you realize that we have all kinds of ways of measuring the health and the well-being of corporations, and our economy is basically organized around that. But when it comes to measuring the health and putting the health of let's say non-human life at the center of our economies. We certainly aren't doing that. But as Chadia has made the point, the relationship between human health and environmental health is very interdependent. So we're realizing that it doesn't really work to keep the environment as an externality in our economic system. So next slide, please. It's positive to see things such as this in New Zealand, Bangladesh, and Colombia. They have started to experiment with this idea of personhood for nature within law. Colombia has granted this to parts of the Amazon, New Zealand to a mountain, and Bangladesh to rivers. However, if this is to really be impactful, it certainly would have to go beyond being something symbolic. It would have to really be integrated through all levels of the law, whether it's company law, financial law, and maybe we could consider creating kinds of, eco entities in some ways, but we're still a bit away from that. Next slide, please. So I think at this point it's just worth pointing to a fact that I think it's environmentalist Bill McKibben pointed out that indigenous knowledge and scientific knowledge are really quite aligned at this moment in time, which is something quite unique. And both of them, in terms of climate change, are saying the same thing. And in those cases, possibly the reason why these countries have started to give nature personhood in their legal systems is because maybe their unique culture. Next slide, please. So if we were then to say, what is the obstacle to really moving forward in changing the law in this area, I think we'd have to point out the common law system, because while for example, the point I mentioned about disrupting contract law would be through common law system, there is very much a history of anthropocentric culture in the common law system. And this is something that has been adopted, many places in the world, UK, US, Australia, parts of Asia. So it's had a real impact on how we think about law and how we think about how law functions. And this case, Juliana v. the United States, this was the case that Chadia had mentioned, a case brought by young people. It came to the Supreme Court, and the judge said, "We reluctantly conclude that the plaintiff's case must be made to the political branches of the electorate, the latter of which can change the composition of the political branches through the ballot box." So they were pointing to this classic notion of separation of powers, that the court does not have the power to act in this case. We shouldn't be too pessimistic about this, because there are countries where we have seen successful cases. For example, as mentioned at the start, the Uganda case, the case in Ireland. But I think we still can see that within the deeper way the law functions, it is difficult to create the kind of changes that we might like to see. And it would be very interesting if law could be a bridge. Next slide, please. So it would be, so I want to also just point out something that has happened in France, which is the Citizens Convention for Climate. So this was 150 self-selected citizens from a pool of random citizens, and they were actually given the task of coming up with some kind of clauses for new legislation. And I think this is in some way is encouraging that, anybody who's listening to this call, even if you don't have a background in law or science or climate change, because this impacts everybody can really get involved in this. And when I say get involved, I mean actually start to think about the details. In this particular case, They were considering taxes. They were considering all kinds of regulations for industry. So they were really thinking about, okay, what can we actually do here? Because I think the environmental movement has always struggled with the fact that the political system is in many ways fragmented, and it limits an integrated global solution to environmental problems. But we do, I think at this point, we do need to see law as, I mean, a bridge is maybe not the right word, but there are a lot of interesting things going on, whether it's in terms of rewiring legal contracts, investing in renewable, and all these things. They in some way, I think, require legal systems that actually, for example, enable them to compete with the current incumbents in the market system, because there's no point in having all these great new circular economy startups if when they actually go to market, they can't compete in terms of price with, let's say, some incumbent industry that has been heavily subsidized for the government. So I think what I'd like to point to is this redesigning. Whether it's legislation or litigation, I think we really need to keep human health at the center of this, and any reforms in law really have to make sure that we consider that environmental health is interdependent on human health and vice versa. And so there's two things really paralleling at this moment, which is, we have this loss of biodiversity, in some ways this environmental crisis, but at the same time, we have innovations in technology, software, medicine, business, digital communications, and personal devices happening at a speed like never before. And I guess what concerns me is that, these two things just won't fully integrate in the way they need to if we are to solve the climate problem. So I'd like to conclude with a slide about human well-being, because I think that what I find encouraging out there, for example, when countries like New Zealand, Scotland, and Iceland are starting to use well-being indicators in their economic models, I feel like this is pretty much the way to go. And in terms of law has never really been something which is about the heart. But if we can find some way to, bring lawyers together with, the people who need to, for example, Chadia mentioned that we need to bring scientists together, and we need to start to think beyond particular siloed models of thinking. And I think lawyers need to be in there as well, and it needs to come from the heart also. So yeah, thank you.
Thank you, Narayan. Okay, at this point, I'm going to just ask Chadia some questions that have come from the chat, and also some questions for Narayan as well. Okay. Chadia, one of the questions is, who and where are you seeing evidence of climate change and pandemic preparedness being integrated into their health systems? You talked about the person preparedness, and many places are not doing that, but where are the places where people are taking that into maybe a more leadership level?
Actually, just recently, we are seeing a lot of organizations, including WHO, focusing more on this interlinkage between climate change and health, but also biodiversity loss and health. And they are bringing other agencies on board through the interagency collaboration mechanisms, and through this trying to implement projects at the country level. We have some examples where we work together to try to make this One Health approach that I described in the presentations that bring the animal health, the human health, and the environmental health together. This approach we are implementing now in several countries in Asia and in Africa. With the support of agencies, including the World Bank financing some of it, USAID also financing some of the project there. But we need to expand. It needs to be mainstream. It needs to be integrated into the usual health system, into the education of the health professionals, so they are aware from the start when they study medical science or public health science, they understand the implication of climate change and biodiversity loss on health, and they know how to deal with it from the start. Thank you.
Another question is, are there certain trends that you're seeing where there's some momentum building, and maybe we're getting to a place of a tipping point where, you know, the right strategies are going to be penetrated on a deeper level?
Yeah. Yeah, actually, we are approaching this. I am optimistic, like Jim said at the beginning, that we are seeing some light at the end of the tunnel because of the suffering that we are facing now from the COVID-19 and the different disasters and economic collapse that we are experiencing. We have the tools now. We can work together to make it happen, and it's the window of opportunity is now that we can make this a change and take it to the next level, where we have the political will behind it, but also we have the financing to make it happen. Because we can develop framework, we can put projects on paper, but if we cannot sustain the financing and monitor the implementation and correct if there's a need to be for changes, we will not achieve the transformative change that we are aiming for.
Do you see any decentralized models for solving public health issues?
Yeah, of course, especially in countries where you have the federal system, like in the US, but also in other countries. I will give an example from the US, where the public health is actually the responsibility of the state and the local government. It's not the federal. The federal just put the guideline and the overall strategy, but then each state, they have their own mechanism and laws sometimes on how to deal with it. But I think in other countries, we are witnessing more and more the rising role of local mayor and local governments coming together to do more work on climate change, but also on public health. And just last week or 10 days ago, we had the first summit of a unit, or they call it Unite, network that one of the parliaments from Portugal convened for other parliamentarians, but also brought health professionals and legal professionals together, and others working on climate change to talk about public health. So we are seeing a lot of this happening from local politicians.
It sounds like a similar solution that Narayan discussed, where a lot of collaboration
Yeah,
is taking place, and this platform in itself is a great way to collaborate around the world.
exactly.
So turning to Narayan, we've seen a lot of responses of people being really excited about this idea of trees having rights, and forests having rights, and also prioritizing public health instead of personal property or property rights. So I guess one question is, what can at-risk communities do? What can they do to that you see to engage maybe in a legal sense?
Yeah, I mean, I think one challenge with litigation is obviously it's costly and it also takes a long time. So, you know, that if there are the resources to start a litigation, you know, that's certainly, you know, an option. But there may be other ways that I think particularly now this issue is really, you know, at such the forefront of conversation that I mean, practically, I would also say that there are organizations that will fund litigation, and some of them will fund it in multiple countries. So that could be something to look into that as an option.
Thank you. And do you think that we can rely on markets and technology to solve the issue? I think you're in your presentation, you're kind of like leaning towards that is maybe not enough. Is there anything else that you want to add?
Yeah, I guess when it comes to the transformative systemic change that the IPCC reports make it clear that we need, I think it's got to come from everywhere. And I would just affirm, you know, what Chadia said, that it's got to come from all directions. And certainly, I do think that unless certain legal reforms happen in certain areas, it may be difficult for, as I mentioned, let's say startups in certain industries to really compete.
Thank you very much. Thank you for our panelists for this great discussion and full of information. At this time, I would like to turn it back to Jim to help us close off.
Thank you, Jenny. You did a masterful job moderating. Thank you, Chadia. And Narayan, you are encyclopedic in your command of what's going on out there. You know, I had no idea. You know, there was 1,000 litigations in the US alone. That's quite extraordinary. And, you know, I love it that the lawyers are decentralizing and, you know, changing individual contracts. And it's, again, you know, it's the world is in pretty bad shape, but the world is also full of, you know, very inventive, creative people of heart, like the three of you. I just want to acknowledge it. You brought joy to my heart today to know that even at this critical hour, you're fighting the good fight, and you're keeping up day by day and night by night to do what's necessary to ensure human survival. And that's what's making Humanity Rising such an extraordinarily exhilarating experience for those of us here at Ubiquity University. So I just want to thank you all. There's probably not a more important nexus in the world than the nexus between climate change and public health and litigation. You know, in some ways, it's a bottom line. And I just want to acknowledge your courage and commitment to take this on. It's quite extraordinary. And you could see from the chats, people were just loving your slides and cheering you on. So you're being welcomed by acclamation for everything that you're doing. So thank you so much. Monday, we're going to take on a very troubling issue, and that is what's going on in the United States right now. And it's of sufficient importance that I decided I was going to make the presentation on my own. I'm a 10th generation American. My people first came to North America in 1686, and we've been present and participatory in American history since 100 years, essentially, before there was even the United States of America till the present day. What's going on in the United States right now is just at the level of the pandemic and public health and climate change, it is criminal incompetence and corruption at the highest levels. The interface between climate and public health is basically non-existent in the halls of the executive branch. There's a denial of climate change and a complete denial of the pandemic, the result of which the United States has about 4% of the human population, and it has well over 20% of all the COVID cases and the COVID deaths. It's an outrage against public decency. We have an election coming up on November 3rd. And within the last week, President Trump has made it clear that he's not going to honor the results of the election. He's increasingly just calling the election a fraud, that the voting is corrupt, in the face of unanimous verdicts of every commission by Republicans, by Democrats, by independent agencies, that the US electoral process is fundamentally sound and fair. But we now have President Trump and the Republican Party in collusion to subvert the electoral process of the United States and to throw the election into chaos by strategic design and throw the matter into the courts, knowing it'll end up in the Supreme Court, which is the reason why the Republicans and President Trump are wanting to replace Ruth Bader Ginsburg, who died last week, before the election, with another arch conservative on the court. What we're experiencing, everyone, is essentially an attempted coup. And we need to understand that, and we need to note it in conscious awareness, and we need to just figure out what we're going to do about it. So on Monday, we're going to talk about the US elections. We're going to talk about the integrity of our constitutional system. We're going to talk about what is happening to subvert probably the most refined and durable democratic system in the world in modern history. And so that'll happen on Monday. Over the weekend, you'll be receiving an email of all the things that are happening every day on Humanity Rising. So I just want to thank everybody for this week. I want you to enjoy the weekend. Get out in the fresh air, hug somebody, share love, practice heart coherence, and know that whatever you're reading, whatever's going on, it's a beautiful, wonderful world, full of beautiful, wonderful people just like you. Thank you, everyone. We'll see you again on Monday. And by the way, for those of you who want to go into the after chat today, the link's been put into the chat every day after the session. If you just want to debrief and hang out and talk to other people about what's going on, join the chat group. And then in about 35 minutes on Humanity Rising Netherlands, if you speak Dutch, feel free to join the session there for the exciting announcement of a national campaign by Humanity Rising Netherlands. So thank you, everyone. God bless. Enjoy your weekend. We'll see you again on Monday.